Module 1, Training in Suicide Prevention. One of the myths about suicidal talk and actual suicidal attempts for children and adolescents is the misbelief they are seeking attention or just crying out for help. At times, young people who talk or write about suicide may be dismissed as being overly dramatic. However, talk of suicide should never be dismissed. It is important to respond to all thoughts and threats seriously. Therefore, an understanding of what factors make a young person more or less likely to consider or attempt suicide is critical. Suicide is rarely the result of a single event. Instead, various factors at the individual, relationship, community, and society levels can increase one's risk of suicide. Risk factors are situations or problems that increase the likelihood a person will attempt suicide. Significant risk factors for youth may include a recent or serious loss, exposure to trauma or a traumatic event, a psychiatric disorder, prior suicide attempts, involvement in bullying, using alcohol and other substances, struggling with identity or sexual orientation, a family history of suicide, lack of social support, access to lethal means, stigma around asking for help, and access to services. These risk factors may also be indicative of homicidal behavior or other serious mental health disorders. Protective factors are things that reduce the risk of suicidal ideation or suicide attempts. Protective factors are comprised of a range of protective elements at the individual, relationship, community, and societal levels. Key protective factors for young people may include strong problem-solving skills, strong connections, relatively easy access to appropriate clinical interventions, and restricted access to highly lethal means of suicide. If a young person has several risk factors and limited protective factors, this is an indicator to be proactive and take steps to intervene. Everyone can play a role in suicide prevention by acting in our schools, communities, and societies to help support young people and safeguard them from suicidal thoughts and behaviors.